Playing defense is never enough. And we're not talking about football here. So I've been a full-time psychiatrist for about 4 years, and I can already tell you that sitting in my office waiting for patients to come see me is just playing defense. About 10 to 20 patients in a behavioral health crisis come to our emergency room in Billings, Montana every day. They come from all over our state, the northern half of Wyoming, and the western parts of the Dakotas. The patients in our region just aren't getting the help that they deserve. And when they do, it's either during or after a crisis. Now, locals will call Montana the last best place, and for good reason. It's beautiful. I moved my family to Big Sky Country so that my girls could grow up around mountains, rivers, wildlife. What I didn't know is that Montana is also at the epicenter of our country's mental health crisis. For the last 40 years, Montana has posted the country's highest suicide rate along with those of Alaska and Wyoming. So why is Montana's suicide rate so high? Nobody knows for sure, but there are at least 3 factors that contribute to this dire statistic. First, much like in New Mexico, patients have to travel very long distances to access specialty health care. There are only 1 million people in Montana, but the distance from one corner of the state to the opposite corner is the same as the distance from Chicago to Washington, D.C. Second, Montanans own lots of guns, giving us a very lethal option at exactly the wrong time. Montana ranks second in household gun ownership at a rate of 61%. And third, Montana is home to 2 vulnerable populations. Compared to the rest of the country, there are disproportionately higher numbers of military veterans and Native Americans in our state. Here's how bad things are when it comes to accessing psychiatric care in rural America. According to the University of Washington, psychiatrists would have to limit appointments to 2 minutes each in order to provide care to every rural patient who needed it. 2 minutes each. And things aren't getting any better in Montana. The CDC issued a report 3 months ago that indicated 1 in 11 high school students in Montana attempted suicide in the previous 12 months. That's 2 to 3 students per classroom. So why do we keep playing defense in the middle of this crisis? I work at the Billings Clinic. It's a fully integrated, accountable care organization, and our psychiatry department has 180 professionals, including 15 psychiatric providers. But the problem is, our people and our know-how are all concentrated in one spot, Billings. There just had to be a way to redistribute these assets in a way that provided more care to more people before a crisis. The problem is, in medical school and residency, we aren't taught how to play offense by changing or even bending the systems of care. Our clinics and hospitals don't incentivize us to think about the big picture. And providers get paid based on maximizing patient volumes, not solving problems. Luckily, I don't know any better. So 4 years ago, when I arrived in Montana, I reached out to the National Alliance of Mental Illness director, so National Alliance of Mental Illness is NAMI, and I asked him to teach me about the local mental health care system. And I thought by understanding it, I could better provide advocacy for my patients. So he connected me to the governor's healthcare policy director, the head of our Department of Public Health and Human Services, and some key local legislators. 2 years ago, I stumbled upon Project ECHO. And the more I learned about it, I thought, this could be the tool that me, my colleagues, and primary care providers could use to start playing offense. Primary care providers are already on the front lines of this, as they prescribe 70% of all antidepressants in our country. So it made some sense, and so I went to the next immersion training in New Mexico. So on day 2 of this training, Diana Linder, she's our director of grants, she reached out to me and said, Eric, the Montana Mental Health Trust, which is a local foundation, just issued a request for proposals, and they're looking to fund innovative new projects to improve the delivery of mental health services to residents in our prisons, jails, and pre-release centers. So when I returned to Billings, we sat down together and crafted a proposal that we hoped would lead to seed money and Montana's first Project ECHO clinic. Now, by the way, get to know your director of grants, your development director, the people in your organization who find the money. If you do, and if that person is only half as good as our Diana, it will be time well spent. Anyway, around that time, our governor, Steve Bullock, was putting together a healthcare innovation council. And he tasked that group with coming up with new ideas to improve healthcare outcomes in general in our state. So he invited CEOs of hospitals, private insurers, healthcare advocates, clinicians, and a psychiatrist, me. And I think I was invited because back in 2013, I started networking with some key stakeholders. Now, I saw this as a huge opportunity to try and convince my fellow council members that we had to start playing offense to get ahead of this mental health crisis. So what I did is to try and set the stage at the first council meeting by preparing arguments that tickled both heartstrings and purse strings. Heartstrings wasn't difficult, right? Montanans were already dying by suicide at a rate pretty much higher than anywhere else in the United States. Mental illness is the #1 cause of medical disability in our country, and half of us are going to meet criteria for mental health disorder at some point in our lives. When it comes to purse strings, I explained that mental illness has a multiplier effect across our healthcare system, and it leads to higher expense, higher morbidity, and higher mortality. And I went further. I ran some numbers and found that anxiety and depression alone was costing Montana $650 million a year in direct and indirect costs. That's 1.6% of our state's annual economic output. Now, fortunately, I wasn't alone on the council thinking that this was a problem. Blue Cross Blue Shield of Montana, they presented some compelling data, and it was more granular. And in short order, the remaining council members felt that Montana's mental health crisis was unacceptable. And so the issue quickly rose to the top of our priority list. So great, we identified the problem, but what about a solution? Well, I proposed a Project ECHO clinic that would help primary care settings across the state integrate behavioral health services into their daily operations. I pitched IBH ECHO, or Integrated Behavioral Health ECHO. And after 6 months of deliberation, the council approved what will become the world's first public-private partnership to fund a Project ECHO clinic. So Montana Medicaid, Blue Cross Blue Shield, and Pacific Source had come together to invest in healthcare innovation. In the meantime, we were lucky enough to have been awarded that grant from the Montana Mental Health Trust. And so we reached out to the Department of Corrections and jointly launched the Mental Health Corrections Collaborative, a weekly ECHO clinic that supported social workers, counselors, and nurses in our justice system. And in about 15 months, we hosted 60 clinics and fielded 100 case presentations. So we now run 3 mental health-focused ECHO clinics in Montana. We're part of the National HRSA-funded Opioid Addiction Treatment Collaborative, and we have at least 2 ECHO clinics in the pipeline. So 2 years after my immersion training, I can finally say that I'm playing offense. And in fact, we have a whole team playing offense. 6 other members of our psychiatry department have completed the immersion training, and over 100 clinicians in Montana are now participating in our clinics. Playing defense is not enough. It's never enough. Playing offense means being a champion for systemic change. It means feeling empowered to reach out to your governor's office, and it means feeling empowered to reach out to that new funder you've never met and get to know your director of grants. So now I invite you to look around, meet your newest teammates, and join me in playing offense. I look forward to it, and thank you.